after seeing healthcare in different institutions, I am now Kendra RN. Why are nurses leaving?
What are we going to do? Like, what are we going to do? Because the way bedside nursing is looking, it ain't looking good. That's the first part. The second topic I want to touch on is, what are you all doing to prepare for your future? Because the way things are looking as far as nursing is concerned, America is going to be a country that won't have nurses. I know you guys might think that's a bit extreme, but the way nursing is set up right now, the way things are going, this is going to be a nurseless country eventually.
Spicy, spicy.
So you all know part of my nursing experience, a good bit of it, is being in the ICU. I worked in the ICU. I, at some point very early in my ICU career, toyed with the idea of going to CRNA school.
CRNA is Certified Registered Nurse Anesthetist, and it's the highest paid path for nurses. That and also NPs are highly paid, but CRNAs, I'm pretty sure, are number one. And essentially think of it as an anesthesiologist light. They're not nearly as well trained as anesthesiologists who are MDs and DOs, but they're doing many similar things in the operating room.
I'm not trying to do that heavy duty kind of schooling. It's too much for me. I am also not willing to not work and not be able to support myself. I don't like science that much. And some of the schools was wanting you to do the GREs. They want you to take organic and inorganic chemistry, physics. I ain't got that kind of time. I'm just being honest. This is not to discourage anyone.
Fucking love science. If you enjoy science, it's gonna make everything way more interesting and way more relevant.
I also don't like the cold. So what would I be doing in anybody's operating room where it's cold as hell?
The ORs are always really cold, unless you're doing a burn surgery, because with burn, the skin barrier is no longer functioning the way it should, right? So for that reason, they keep the temperature much higher because you don't want to have too much heat loss. But other than that, yeah, it's pretty cold.
But being in the ICU was also a strategic move for me, because being there meant that I only cared for 2 patients, 2 bodies. Yes, those 2 patients might be very sick, but it's only 2 of them, and all my resources are here. So it was a no-brainer. Like, why would I be on med-surg or IMC or tele running around like a chicken without no head? So most of my career was spent in the ICU.
So med-surg, that's like when you think of the regular inpatient in a hospital, that's med-surg. My girlfriend is actually an ED nurse, and it is insane. Like, sometimes she'll have, there was a day last week where someone called in sick and she had 12 patients, which is insane. I think she's supposed to have something like 4 at a time, sometimes up to 6, which is also a stretch, but 12, it was nuts. And she's actually interested in ICU. I think the patient load, as Kendra is saying, is probably part of that.
When I first started back as a tech, not even as a nurse, when I worked as a tech, the nurses would have, let's say, 5 patients. The ratio has not changed much. When a nurse had 5 patients, at least 3 of those patients would be a walkie-talkie, meaning that they were independent, they can get up, they can wash themselves, go downstairs to the cafeteria. Patients was going outside to sit and smoke and have a good old time, okay? Patients were making friends outside while sitting outside in the summertime, right? Then I became a nurse, and then, the patient load, still, I had patients that would go downstairs, or I'll be right back. I have to go outside looking for them because they've been gone for how many hours, whatever. Today, 2023, 2024, those 5 patients, no more self-care patients, none. Everybody's a complete care. Literally, everybody is a complete care. What is happening?
I wonder why that is. So for her, it could be that maybe she changed locations. That could be part of it. If it's the same location, is there something with the patient population that's changing? But let's say it's not just for her. Let's say it's for everyone, or for most people in the US. Most nurses are feeling this way. What could the possible reasons be? I don't know. During COVID, a lot of people were not going to the hospital because they didn't want to be exposed to COVID, et cetera, unless of course they had COVID and complications. So is it that people were waiting longer for things that maybe they would otherwise have been seen sooner for? I don't know. Is it that Americans are getting unhealthier by the year? Possibly. Is it something to do with the private equity firms buying up various practices and the pressures to make medicine more and more profitable? Just some thoughts, not sure.
All of my patients were complete cares. All of them were incontinent. Some of them had finger sticks and needed insulin coverage. 3 of them had like really bad pressure ulcers on their bottom. And I'm just like, how? Then the best part, because people always ask me this on TikTok, or you guys will ask in the comment, well, don't you all have CNAs? Isn't that why there's a CNA there?
CNA is Certified Nursing Assistant.
Let me tell you something about these new girlies out here today. The girls are doing nails. The girls are doing hair. The girls are braiding. The girls are driving Uber. They're driving Lyft. The girls are cooking and selling meals. The girls are babysitting. The girls are dog walking. The days of a young lady who's maybe 19 or 20 looking to make some money, looking to have a job, long gone are the days where people are running to sign up to become a CNA, because the workload is so much, the demands is so much that these younger folks are like, what? You want me to do what? Stand and take care of who? Hurt my back and pull who or what? I'm not doing that. I'm gonna just go learn how to do nails and get certified on how to do nails.
That's interesting. I never actually considered that those other things that are probably paying a similar amount per year are gonna be a lot more appealing and less work. What I have here in Las Vegas is the average CNA makes $38,000, 75th percentile is $44,000, and 25th percentile is $32,000.
That's what these younger people are doing now. Like Gen Zs, even like, they're not trying to be at nobody's bedside taking care of patients. Which leads me to the next topic, the conditions in which patients are today. If patients have gotten progressively worse over the past 10 years, what's gonna happen in the next 10 to 15 years? That means they're gonna be even worse. And they ain't gonna be no nurses. Because here's the thing, a lot of people who are coming into nursing right now, a lot of them are younger. They get burnt out really fast. And there's other things that they go on to do. Like some of them will become nurse practitioners. Some of them will want to go into mental health. They want to go to anesthesia school. The nurses that are coming out these days, nobody is trying to be at the bedside for 10, 15 years. I am the last of that generation. I'm 14 years in. These young girls that are coming out, the 21 to 22 years old, they ain't got time.
I think a big part of this is, like I alluded to earlier, the pressure to make medicine and healthcare more and more profitable. Because what I've been seeing amongst my physician friends and colleagues, and with my girlfriend who's a nurse, is that everyone's getting spread thinner and thinner and thinner because it's just cheaper that way for the hospitals, because personnel are incredibly expensive, right? And don't get me wrong, I'm all for capitalism. Out of all the systems out there, it's the least evil, the least bad. But what it's doing, this unregulated way of approaching healthcare, medicine, it's fucking sad to see.
A lot of them like will get offered $30,000 sign-on bonuses, and them girls is like, we don't want it. I ain't trying to have nobody hold me to their hospital. When I'm ready to go, I'm ready to go. That's how the girls are moving these days. So thinking about the future and looking at the condition at which patients are presenting now in the clinical setting, I can only anticipate that the quality of life, the health of the population is going to further deteriorate if we don't start taking our health more seriously.
I mean, yeah, I totally agree with her. I never thought about people taking worse care of their health as burdening healthcare staff more and more, but it's a valid point, right? Like if people are more sick and you're expecting the same number of patients year to year, but all of a sudden it starts increasing year after year after year, then yeah, it's going to be tougher for healthcare professionals. But one thing that I think a lot of lay people don't realize is you don't want to go to the hospital. It's not like, oh, I can get sick, I can get injured, the hospital's right there across the street, I'm gonna be fine. No. You never want to go in there. The amount of medical errors, the amount of contagious diseases and microbes that are gonna infect you, the fact that being healthy enough to not go there in the first place is gonna have way better outcomes than going there and getting a full workup and having the smartest, best, brightest minds and the latest medical technology work on you. It's just better to be healthy and not have to go there. And that's why, as you guys have seen on this channel, I obsess about my health. I wear CGM, I have a Whoop right here, I got an Apple Watch. It's a bit excessive, you don't have to do all those things. I do it because it's fun and the data, but all of it is serving this purpose of how can I try to improve my health span, not just my lifespan. I don't want to live to 100 years old and be bedridden for the last 20 years. I want to be active and racing cars until I'm 99 and then go out quickly rather than having this really long and painful decline.
The amount of comorbidities an average patient has, for example, if I get reported on a patient on med-surg, this is what the past medical history sounds like. Patient has a history of hypertension, CAD.
CAD is coronary artery disease, and heart disease is the #1 killer of Americans.
Type 2 diabetes, the left leg is amputated, patient has a wound on the left leg that's not healing, the doctors are considering amputation, patient is on dialysis, goes to dialysis Monday, Tuesday. Girl, hold on right there. Hold on. That's the medical history, right? So you also have to consider, let's just say a patient gets admitted for a small bowel obstruction. I don't know if that's the first thing that came to mind. Patient gets admitted for a small bowel obstruction, but then they have that history that I just mentioned. So as a nurse at the bedside, you are managing the current diagnosis, but then you also have to consider the fact that your patient's a diabetic, your patient has a wound, your patient already had an amputation, meaning that they're not more than likely mobile, meaning that that patient is probably a moderate assist to complete care. It's a lot. People are sick. So I'm here to ask y'all, what are we going to do to prepare for our future so that way we are not burdening a healthcare system that more than likely will not be able to manage and meet the demands of the population the way things are going. I'm telling y'all, there's not going to be any nurses. For example, it wasn't uncommon for, let's just say, like, I'm a nurse, I have 2 daughters. It wouldn't be uncommon for my 2 daughters to be like, oh yeah, I want to be a nurse just like my mom. When you ask my daughters, number one, my 12-year-old, that girl is something else. But when you ask her, Coco, you don't want to be a nurse? No. No. I told you, mommy, I want to be a software engineer. Okay. The oldest girl, she's 20. She currently works part-time as a dietary hostess in a hospital. And she comes home all the time and she's like, I don't see how you do that job. She's like, I just can't. She's like, I don't see how you do it.
Yeah, the stories I hear from my girlfriend are pretty wild. They're pretty ridiculous and stuff's unsafe. So I'm glad that after 9 months of working in this ED that she's at, she has put in her 2-week notice and is looking for a different job. Because at a good number of institutions, healthcare staff, nurses, doctors, etc., they're not treated the way that they should be. And I think it's important, if you're at one of those institutions, don't continue to support that behavior. Those who are unhappy with the environment, with the working conditions, yeah, go find other jobs elsewhere, because then that institution is going to be forced to change the way they're doing things and improve it to have something that's at least a decent standard.
A lot of people are discouraging their children from going into nursing because the job is too difficult. It's challenging. It's not manageable. It's not realistic. It's not feasible. I don't know what else to say. And here's the thing. I don't see any improvement coming. I don't see any improvement because hospital administration, they don't care. And then we have nurses that are in the positions of like being managers. They're up in senior administration. They don't give a damn.
One thing that I do always want to be careful of is when we ascribe malice to people's actions, and what likely is happening is that a lot of people are getting squeezed. And it may or may not be that they don't care. It may just be that there are other things that are higher priority and stressors in their own lives for their own job that doesn't allow them to then work on things the way that they might want to if they did have a little bit more leeway.
And I was overhearing the nurses complaining to, a nurse executive, a nurse that's in administration. They were complaining like, listen, the workload is too heavy for us. We cannot handle it. Yet you guys are keeping us at the same ratio. The fact that the patient population has gotten sicker on a med-surg unit here in Maryland, where a nurse will get 5 patients, that nurse really should only be getting 4 patients because the patients are sicker. They require so much more care. It is almost impossible. And guess who's suffering? The patients are the ones suffering.
And not just that, but medical errors are much more common when people are understaffed and rushing and not able to do their regular checks and take their time and be very intentional about each of their actions. you hear these crazy stories all the time. I mean, look at the stats. The number of medical errors causing death in the US is at a number that is way too high.
So I'm in the room with Pop. I gotta find a way to put Pop back up in the bed. So what that means is I have to now get creative. I have to unbreak the bed, pull it from the wall, go behind the bed, put it in Trendelenburg, so like the bed is like backwards like this or like this. Yeah. So the bed is like this, and I have to like stand behind and pull on the sheets to get Pop back in the bed so Pop is not on the floor. I clean him up, get him nice and fixed up. Okay, cool. Whew. Okay, now let me go check my other 4 patients.
Dude, I really appreciate what nurses do, because the stuff they're having to do, cleaning these patients, they've made a mess and such. It takes a certain kind of person that's very patient, that's very like caring, that I know that I personally would really struggle with a lot of the work that they do. So kudos.
Everybody is always looking for the nurse. The nurse can fix everything. Everybody's always looking for the nurse. I'm talking about in person, the phone call at the desk, and the device that we carry. It's always going off. It is impossible to be the kind of nurse that I was trained to be and that I want to be to my patients working on day shift. So now your girl switched to night shift. And it's a little bit better, but the patients are so heavy. They're heavy. So that is the reason why I want to have a conversation about what are we, like the people now, like us, what are we going to do to help ease the burden later on as we grow older? Like, y'all got to start eating right, drinking water, taking vitamins, and most importantly, moving your body. Like here in America, we have too much of a sedentary lifestyle.
I love her energy. She's right though. I mean, preventive medicine is, in America, people don't want to be told to eat better and to exercise more frequently. They want to be told, or rather what they're hoping for is a magic pill that's going to solve all their problems so they can keep eating Cheetos and watching TV all day and not getting their ass off from the couch.
The lack of staffing, the lack of support, the fact that the young girlies are doing nails and doing hair instead of trying to go to CNA school and then eventually go to nursing school, that has dwindled down. That's becoming a thing of the past, y'all. I cannot take care of the patients in the way I want to because the load is too much. The patients are the ones not getting the care. And that brings me to another point before I close this nurse talk out. A lot of y'all family members gotta start doing better. Like the fact that you have a family member that's ill and in the hospital, for you to think that your family member is gonna get tip-top nursing care, it's irresponsible. It's irresponsible for you to think that, considering the complaints and the outcries and the strikes and all of those things that you've seen over the past year. It is irresponsible for you to think that it is okay to drop your dad off. You come visit him and all you do is sit there. No. Families, y'all gotta start getting involved in taking care of y'all relatives and taking care of y'all loved ones.
Real talk, after seeing healthcare in different institutions, I am now much more selective than I was earlier about where I would go or where I would want my family members to go to receive their care. Because I think the difference in level of care is greater than most of us probably expect.
Nurses at the bedside, we need help. The fact that family members come and they just sit there, like you don't have to do it all by yourself. We don't mind helping, but y'all need to start taking more of an initiative. Because of course, there's always gonna be people who are saying, but that's what you signed up for. You don't wanna do no work, you just don't wanna do your job. No, the job has become impossible. Like to have to come home as a nurse and sit and run through your mind and kind of make peace with the fact that you tried your best, even though you couldn't get everything done. You really, really tried. It's morally distressing to know that, damn, I really would have liked to turn that patient more, but I just couldn't because the load was heavy, time wouldn't allow. I had 4 other patients that were complete care that we needed to take care of and give medicines to and do documentation and measure wounds and do wound change and bathe them and all of those things. Like, it's a lot, y'all. It's a lot.
A lot of people in healthcare are really struggling right now, and things tend to be getting worse and worse with every passing year. I remember back when I was in med school, we admired the nurses because we're like, man, they do such a good job of lobbying and petitioning and getting restrictions for how many hours they can work, needing to have breaks, at what frequency those breaks occur, stuff like that. And then when you're a med student or a resident, there's none of that. And you just get worked hard and ground down. And maybe part of that was related to the institutions that I was training at, but it does seem like nursing has gotten tougher since then. I started med school back in 2012. And you guys know the mental health and well-being of medical trainees is really important to me. I saw a lot of suffering. That's why we started Save Our Doctors initiative so many years ago. But it's not just the doctors who are suffering. Yes, doctors, they have this the highest rate of suicide, depression, burnout, which is really problematic. And they can probably learn things from other healthcare professionals, especially nurses, who are very effective at unionizing and lobbying and things. But other healthcare professionals, such as nurses, are also suffering, and things are just getting worse and worse and worse. And who's going to suffer? Patients. That's a big problem. I wish there was an easy solution, but it's a tough one. What do you think? Let me know with a comment down below.